Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me today, Adam Thacker, our Chief Operating Officer of Good Samaritan Hospital. As usual, we will be talking today a little bit about the state of COVID in our community. We'll be talking a little bit about statistics as far as numbers. Also, of course, about masking, and then we'll be talking a little bit about back to school. We've had school kids going back in session over the course of the past couple weeks, and we'll be discussing a little bit about the issues associated with that and what to watch for and what to call your providers about. So just to lead off with today, some local statistics. Probably the most important thing is, again, the number of active cases that we have in our community, which is 42 right now. If we look back over the course of the past few weeks or so, one thing that we've talked about each week is our positivity rate. Adam will speak a little bit to that this morning because we've seen tremendous fluctuations in that. And as we started out, our long-term positivity rate was running 5%, 4.5%, so forth. But we've seen a lot of volatility of that over the course of the past few weeks. Can you talk a little bit about those numbers?
Yeah. So as we mentioned last week on the positivity rate, we're really looking at two sets of rates. The 7-day trending rate, which is what's going on now, current time. And we've seen that volatility. A few weeks ago, we were in the 12% range, and then we dropped down into the 7% last week when we were on Facebook. And then this morning, looking at the newer data that's been updated, we're at 13.8%. So as we see additional positive cases, that rate is going to increase. Our total positivity rate is 5.5%. So as Dr. Stine mentioned, we've been running in the 3-4% and seeing that kind of slowly tick up. It's not cause for concern. We expect to see some of that volatility, and as we've increased testing and the number of individuals seeking tests, we're going to identify additional positive cases. We've tested over 3,000 individuals through our site here at Good Samaritan, and then there have been other Knox County residents get tested outside of Good Samaritan as well. So that with the positivity rate, when the 7-day trend is above the total, that means that we're seeing an increased community transmission here locally. And so the masking, hygiene, physical distancing where possible, all of those things really get highlighted as those are the activities today that we can put into place to kind of move that curve down and trend the other way.
A couple of things that we've been very fortunate about. If we go back to March when this all started, we had been very fortunate up until just recently that we had very little community spread. We had none of our nursing homes affected, and we had no local deaths. But since we spoke with everybody last week, we've had a couple local deaths of local residents. We've also seen some cases show up in our local facilities as far as nursing facilities. It's important to realize that we have somewhat expected that from the beginning and have been very fortunate up until recently that we have not had any of those cases. But the other thing to look at is we expect that some of our population that has more comorbidities are going to be more ill and have more difficulty. And so unfortunately that's what we've seen over the course of the past week or so. The other thing to look at is Adam mentioned that we've done lots of testing. So when people ask about the availability of testing, we have tremendously ramped that up over the course of the past couple months or so. And so we're getting a bigger sampling of our population, and we're seeing more positive cases. Now, a lot of things have happened when we look over the course of the past 2 months. We've had a couple of holidays. We've had kids going back to school over the course of the past couple weeks or so. People have asked me about cases within our schools, and we're seeing, of course, a number of people that are showing up positive within our school systems. And how we're addressing that, I think, is kind of the next big thing that people are curious about in terms of if my child is sick or if my child is sent home, what do we do and where do we go from there?
Right. And so in those events, we're working closely with the schools to get materials handed out that they will have on their website or that their nursing clinical staff can help to hand out to parents and students to guide them. If you have a primary care physician, it really starts there. Contact your primary care physician or nurse practitioner to look to schedule an appointment. That may be a in-person appointment, or it could be a virtual appointment, which we have really ramped up our capabilities for that. If you don't have a primary care provider, we have a Find a Provider line that you can call. We also have that on our website where you can go and access the Find a Provider online and put in the information, and then somebody will reach out to you to get an appointment scheduled, again, either in person or virtual. And then our Convenient Care, which is the Willow Plaza location, acute care, non-emergent is the walk-in clinic or drive-in clinic. You can pull up and park and call, and one of our nurse practitioners will come out, assess you, and determine whether testing is appropriate. As we know with the schools, the Indiana State Department of Health has worked closely with the schools. If your student is sent home due to illness that is related to COVID symptoms, which is a pretty expanding list of symptoms, then you do need to be assessed by a provider for alternate explanation of reason for illness to be able to return to school timely. Otherwise, out of really an abundance of caution, the school systems are going to keep you out for that 10 days and 72 hours fever-free symptom resolution. So in an effort to keep students in school as much as possible, that contacting us, getting assessed is really important.
And one of the things that Adam mentioned that's really important is to find out if there's an alternate reason for why the individual is ill. So whenever people contact us and speak with our nursing staff or with our triage line, one of the first things that we try to figure out is that person ill enough that they need to be seen by a provider right away? And we will get those patients in to be seen either through our primary care services or through our community care services. The next thing that we tend to sort out is to try to find out if there's another explanation for the symptoms that they're having, because as Adam had mentioned, we're heading into ragweed season this time of year. This time of year, because school is starting up, we see viral gastroenteritis, which produces nausea and vomiting, diarrhea and fever. We see a multitude of other types of viral upper respiratory infections, including rhinovirus and adenovirus and a variety of cold viruses that produce very similar symptoms. So one of the first things that we want to sort out is how ill that individual is that's sent home from school or sent home from work, get them clinically evaluated, and then find out if they need to have testing or not. Because not everybody necessarily needs to have testing to return back to work or return back to school. One of the things that we want to make sure that people are clear of is just because you get sent home from school or sent home from work and you've had a fever or respiratory symptoms, so forth, that doesn't necessarily mean that you have to have a test done to return back to the services. So as Adam had mentioned, if we can come up with an alternate explanation as to why you are ill or why you're having symptoms, and then you remain fever-free, then you're okay to return back to work or return back to school.
And that last piece you mentioned is really a key element, so that fever-free, symptom reduced. Just getting a negative test, if you still have a fever, it's not return to school, it's not return to work, because there is still the timing of the test could be negative while you're creating that viral load that is detectable. So you could be infectious and around folks, and that's how some of the larger areas have had widespread transmission because of, I guess, a false security of feeling negative. So that symptom resolution is really important regardless of COVID testing or alternate explanation. Have to see that improve before returning to work or school. And we've talked a lot about the school reopening because those are big events, large groups coming together, but the workplace, the same rules apply in making sure that we're following that guidance and working with your employer closely.
And one of the other things that's important to keep in mind is our kids generally do very well with this illness when they have it. We see a very few numbers of kids across the nation who have come down with this illness that have to require any type of treatment. Most of the time they recover and convalesce on their own over the course of a few days without any type of treatment. And that's been the case with the majority of patients. As we have seen over the course of the past few weeks or so, the number of cases increase. Although we have seen an increase in hospitalizations, the number of those patients that have been transferred to the ICU or have been critically ill still is extremely small. And that's important to realize that the majority of patients who come down with COVID-19 will have no symptoms, 45% or so, right. And the ones that do come down with symptoms have an illness that's fairly self-limited and requires little or no intervention. That being said, the reason to come to the hospital, the reason to contact your primary care provider is if you sustain a fever, you're not able to eat, you're not able to drink, you get more lower respiratory symptoms, meaning you're more short of breath or wheezy or have difficulty walking. Those are all reasons that we want you to get clinically evaluated right away. One of the other subjects that's come up, and there's been some interesting research released over the course of the past week or so, is the Duke University study on masking. And of course, the question from the very beginning has been, why do we mask, and what type of masks, and what good do masks do, and is my mask okay versus your mask? And what this study did was basically look very simply at what happens when we wear masks, what particles come out, and if those particles are more or less with certain types of masking. And the answer is masks help. There's no question. And when we are wearing our masks in our community, we are protecting others. And the rationale behind that basically has been that we're not releasing respiratory droplets that the little viral particles hitch a ride on the way out. Now, you will see people obviously in our facility wearing protective equipment that's different, not so much in terms of homemade masks and things like that, but medically approved things because we want to protect ourselves and protect our patients. But one of the things that the study showed was basically that masking, there's no question about it, a whole variety of different types of masks help. There is some question as to whether the spandex polyester types of neck gaiters probably don't help as much as what everybody had thought, but there's no question that the homemade masks, cotton masks, things like that are helping to prevent the spread.
Yeah, and that's a really important piece to hit on, is that mask work when worn effectively. So covering mouth and nose, except when eating and drinking, and you'll see that throughout our area when you're indoors in those confined spaces. I mean, that's the executive order. When you're outdoors and can space out, that's where masks can be taken off and are not need to be worn from a protective standpoint. And then, as you'll see, if you come to Good Samaritan, eye protection. I mean, that's another piece, as we've talked about very early on with how virus can spread is through those entry points of mouth, nose, and eyes. So you'll see that here at Good Samaritan as we're trying to make sure that our staff are protected, because in the healthcare setting we're introducing many infectious material or viruses, not just coronavirus. So we want to make sure our team is protected. So don't be alarmed as you come into the hospital that you see that our garb looks very different than what you would in the community, but it's that medically approved equipment that helps to keep our staff safe and keeps patients, visitors safe in the event that there were a staff member that were asymptomatic.
One of the things I've been inspired by in watching how good people are doing with masking is our kids do very well with masking. Just like our kids led the way with teaching us how to cough into our sleeve and not into our hands. Early on in this illness, it was apparent that the kids knew a lot more about that than what we did, and they would come home and teach us, hey, you're not supposed to cough into your hands, Dad, you're supposed to cough into your sleeve. But they've done very well with masking too. There have been a lot of questions as to whether masks are making people ill and whether masks are safe, and a lot of that is just garbage that gets spread around the internet. The masks are very safe. They are not harmful to our kids, and our kids are doing very well with them. As Adam mentioned, it's important that obviously any time that we're in an environment where we can't social distance indoors, we need to be wearing our masks. We've seen good usage of masks locally, and we talked a little bit last week about thanking people and helping people to appreciate the fact that you're wearing your mask to protect them and they're wearing their mask to protect you, and helping to spread that goodwill around the community, because I think that really helps people understand that we're all in this together and we're all trying to decrease this rate of transmission. As if we can do that well over the course of the next few months, as we anticipate moving into our cold and flu season, that's going to help everybody.
I think I hear a lot with the masking is when will we be able to stop wearing a mask? And I think, as you and I have talked, it's a ways off. So not to give any false belief that in a week Governor Holcomb is going to announce that the executive order is removed. We don't expect that. It is going to be into the fall and likely into next year in the spring. So I think it's something that we need to become comfortable with and create a habit with. I know it's increasing my steps because I leave my vehicle or office half the time without my mask, and I catch myself and have to turn around and go back and get it. And that's fine. But we'll create those habits and get more comfortable with it, because as was mentioned, wearing a mask is not unhealthy. It's uncomfortable until you get used to it, but there's no science to prove that there are health concerns with wearing a mask.
We'll move on to taking some community questions. Tiffany, did you have some questions from folks that are listening with us today? Or is everybody asleep still? Or just haven't had their coffee?
It doesn't look like we have any questions right now.
Okay. Well, certainly we want to encourage everybody to mask up. Please be cautious around people. Make sure that you're thanking people for wearing their masks. We really want to do our best job masking right now that we can. Our kids are back in school. We would like to keep them there if at all possible. We are seeing a bit of a surge in terms of numbers of active cases in the community. We know that masking works. Thankfully, the cases that we are seeing have not been all that ill, and thankfully the resources and preparation that we've done over the past several months has helped tremendously to prevent being overrun.
Right. And as we look at what's been true since the very beginning. Older population, those with chronic lung diseases are likely to have a worse outcome. So even if you feel just a little ill, a little off, keeping distance from extended family that may have a worse outcome, I mean, that's certainly something that we encourage. And we did mention earlier, we have unfortunately seen death related to COVID in Knox County. I think one thing that's just worth commenting on is that we've had a few questions not come in this morning, but come in via email as to, do hospitals benefit from that? Were those truly a COVID death, or
Sure.
were they just tagged as COVID? We report through HHS, which is Health and Human Services, up at a federal level. So any patient that has a confirmed positive COVID is considered a COVID-related death. They may have actually died from a heart attack or some other illness that was exacerbated due to COVID, but COVID is related to that. So we report the same as every hospital across the country, and I assure you it is not a financial boom in any way. We don't benefit from that. It's just a matter of being able to track the data and understand what the impact of this virus is so that we can make the appropriate responses to how we need to address the health and safety of our communities.
If people end up with questions over the course of the next few hours throughout the day, please feel free to email us. We'll be monitoring that throughout the day, and we'll get you answers back later. Again, thank you very much for joining us this week for Good Samaritan Facebook Live. Adam and I will be back with you in a week.
Thank you.